Ever stood in front of a crowd to give that well-prepped speech and found yourself tongue-tied? If that's the case, you might be having social phobia or social anxiety disorder. But what's the difference? In this video, you will figure out what these two terms mean. Before we find the differences between the two conditions, make sure to subscribe to our channel for more content like this, because a lot of content similar to this is coming your way. If you do happen to be afraid of being judged in public, you're not alone. Though it may feel like you're alone in your fears, social phobia and social anxiety disorder are actually quite common. In fact, about 15 million American adults are affected by this condition. But most people tend to shrug it off, try to swallow their fears, or avoid social situations entirely. Despite the wide availability of effective treatments, very few people seek help. So remember that it's not something to be embarrassed about, and it can be overcome in time. The first step to making sense of your discomfort will be to figure out whether it's social phobia or social anxiety disorder that's clouding up your sunny days, because the last thing you need would be to freak out over the mishmash of terminology. If you've ever Googled about any mental health disorder, you may have come across something called the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. Published by the American Psychiatric Association, this is the handbook widely used in the US to diagnose psychiatric illnesses. It contains descriptions, symptoms, and any other factors required to diagnose a mental health condition. As per the DSM, the difference between social phobia and social anxiety disorder is a matter of which edition of the DSM you refer to. Meaning, social phobia is the old word and social anxiety disorder is the new term. Now, if you think that it suggests that it does not matter which term you use, wrong. The change in terminology came with a shift in the scope of the condition, in that social anxiety disorder is wider in its application. It has some added symptoms as opposed to the older word, social phobia. In simple terms, social phobia was simply a type of phobia, as in intense fear. It only included the fear of being scrutinized and judged while performing some type of task in public. But this isn't very inclusive, is it? Most people feel extremely uncomfortable doing certain normal things in the company of others to the extent they change their behavioral patterns, but not many of them would describe it as a fear. Social anxiety disorder, on the other hand, describes the feeling of intense nervousness and self-consciousness, which a person may experience during one-on-one meetings or group social gatherings. Now, that's more relatable, right? Like we mentioned earlier, these feelings of nervousness are not uncommon, and they are absolutely nothing to be ashamed of. Just because the person sitting next to you on the bus has the guts to wear a neon top and wiggle about to some random song while you feel awkward just pulling out your headphones doesn't mean that there's anything wrong with either of you. We're not all wired the same way, and every one of us have our own unique set of strengths and weaknesses. But if you feel like your nervousness is getting in the way of our daily life, you might want to reach out. By the end of this video, you'll have a sense of where in the spectrum of fear to nervousness you fall, and you'll get some tips to take hold of these emotions as well. So, let's get our basics straight. Being nervous is not the same as being afraid. That is the underlying difference between the two terms. Social phobia refers specifically to the extreme fear of acting in public, where a person is exposed to the observation and comments of another person. Common to all other phobias, social phobia also has certain triggers. It can be provoked by most public activities, even though they are everyday acts. These include delivering presentations or speeches, eating in crowded restaurants, using public restrooms, taking public transport, signing their name in public settings, exercising in gyms or outdoors where other people are present, public speaking, artistic performances. Yes, all of these probably seem daunting to most introverts, but those with social phobia are so afraid of these tasks that they might call in sick to avoid doing them, or even actually fall sick because of their fear. This gripping sense of fear can make their minds go blank, and they could just freeze in place. For those of you who love the public attention and comments, This fear might sound silly, but like I mentioned, we're not all wired the same way, and we're all wonderful people in our own ways. Once social phobia was replaced with social anxiety disorder, it essentially classed it as an anxiety disorder instead of a phobia. The condition now included the insecurities related to being in public as well as the fears. Social anxiety disorder can manifest in many public situations, ranging from one-on-one interactions with strangers or even with not close friends. This includes job interviews, checkout at supermarkets, talking on the phone, face-to-face conversations with strangers, etc. As you can see, this covers not just crowd-based interactions, but any interaction with strangers or acquaintances. But then again, just because you freak out when you order pizza or accidentally blurt out "same to you" to someone who wished you a happy birthday doesn't mean that you have to self-diagnose yourself with social anxiety disorder. In the perspective of someone on the social anxiety spectrum, being exposed and criticized based on social performance is a disaster. It's something that can make them freeze in fear or giddy with anxiety, depending on where they fall on the spectrum. The physical symptoms of both social fear and social anxiety are like those of a panic attack. They can occur before and during a stressful public situation. These can include, but are not limited to, dizziness, sweating, shivering or shaky hands, blushing, racing heartbeat, constricted breathing, muscle tension in the face and neck, stomach cramps or pains, rapid or stumbling speech, mental blocks that make it hard to think or absorb information. In addition to the physical reactions, someone with social phobia or social anxiety can experience certain emotional symptoms as well. This is why it's crucial for people around them to understand the situation instead of just yelling at them or forcing them to push through. Social phobia and social anxiety can lead to feelings of paranoia. They can feel like the entire room is watching them and judging their every move. They can worry that they are making a fool of themselves, leading to low self-esteem and low self-respect. They will also tend to overthink a situation and think and rethink their words and actions, even after the situation is long ended. Ever gone out with a good cup of tea to enjoy the view and suddenly get bombarded with all the minute awkward things you did for the past 10 years? Yeah, we feel you. Unlike social phobia, social anxiety disorder, in addition to the nerves, is accompanied by feelings of intense shame. Those affected feel ashamed of their behavior in public. Then they feel ashamed for being ashamed, and it's a downhill slope from there. The feelings of shame and fear can lead them to avoid certain situations which most people wouldn't think twice about. They then have trouble trying to understand why. If everyone else is doing it with ease, they agonize over it. If you happen to have these thoughts, let me intervene here for a bit. It's not that the entire world is carrying out those tasks which you find daunting with absolute ease and comfort. That's just a lie your anxiety keeps whispering. There are lots of people who are extremely uncomfortable with many public activities, but they pretend to be okay with it, thinking that's what it takes to fit in and go with the flow. But although fake it till you make it seems like a good strategy, it's not at all healthy to suppress your feelings in public, only to come home and have a breakdown on your own. This condition can be overcome, and it's best to reach out for a helping hand. If you do experience these symptoms, keep in mind that scolding or insulting yourself is not very healthy or necessary in the least bit. Just take a deep breath, excuse yourself if you can, and imagine what you would tell your best friend if they were going through something like this. And if a friend or a loved one is going through something like this, please understand that asking them to just suck it up is the worst advice. What they need is some peace and quiet, some way to let their brains know that it's safe. So, what they need is your understanding and a little helping hand, not a spoonful of your opinions on the so-called weakness. The good news is that it is possible to rewire your brain. You can literally teach your brain to not freak out in public situations. You can expose yourself to social situations in controlled doses, instead of avoiding them like your anxiety wants you to. And unlike trying to shove yourself through press conferences on day one like the world advises you to. Start with a small act, something you can take at your own pace. Try to think about the weather. If someone else was doing that act, would you be judging them the same way you're judging yourself? Maybe at some point in your life you were intensely judged by someone, but not everyone is like that. In fact, we're all so busy with our own work that we hardly notice what the person next to us is doing. Once you teach yourself to expose yourself slowly, these feelings will eventually subside. And always remember that if you're having trouble managing it alone, it's completely okay to reach out to a doctor or a trusted friend. Can you relate to any of these symptoms? What social situations do you have trouble with? Let us know in the comments below. And remember to like this video and subscribe to our channel for more mental health tips. Thank you for watching, and see you next time.